I'm Dr. Thaddeus John Bell. Today I'd like to talk to you about diabetes prevention. You know, South Carolina has been designated as a part of the diabetic belt, as many other states in the southeastern part of the United States. Today we have seen a tremendous number of diabetic patients. Many of those patients we have just made the diagnosis of diabetes. I thought today that I'll give you some tips about how to prevent diabetes, since it has become very apparent to us that when many of these patients get the diagnosis of diabetes, they become very, very depressed and oftentimes go into denial. If your doctor tells you that you are right on the verge of developing diabetes, there are some things that you can do to prevent it or maybe hold it off. Number one, you want to reduce your weight. You can do that by cutting back on the amount of food that you're eating. I talked to the dietitian, the diabetic dietitian, about this the other day, and she told me that even without going to the class, if you can remember to divide the plate up into 4 sections, 1/2 of the plate should have vegetables on it. Then 1/4 of it should have a meat. And then the other 1/4 should have a starch. So you want to reverse the way that you've been eating. Most people eat a lot of starches, a very small amount of vegetables, and a large portion of meat. And then, of course, you always want to keep some type of fruit in your diet. You want to eat fruit on a daily basis. And then finally, I'd like for you to consider cutting out all of the fruity drinks that you've been drinking. Cut out all of the iced tea. Cut out the sodas that you've been drinking. And then you want to try to exercise most days of the week, 30 minutes every day. Now, if you do those things, your risk for not developing diabetes goes significantly down, even if you have family members who have diabetes. And remember, get yourself a fruit instead of eating some type of fast food or some type of junk food. I'm Dr. Thaddeus John Bell, closing the gap in healthcare.